So good morning everyone, or good night. My name is Kirsten Miller and I'll be giving a brief presentation about Kapandji's knee models. So first off, the knee. The knee is the intermediate joint of the lower limb and plays a major role during gait. The main movements of the knee are extension and flexion. A diagram of these motions can be seen in the second figure. The second movement the knee undergoes is internal and external rotation. However, this movement can only occur during flexion. We won't talk much about it during this presentation. The knee is made up of several ligaments that serve as primary stabilizers during static loading and dynamic motion. These ligaments include the medial collateral ligament, the lateral collateral ligament, the anterior cruciate ligament, and the posterior cruciate ligament. Specifically, the MCL and LCL aid in preventing medial and lateral displacement, while the ACL and PCL prevents anterior and posterior displacement. The ACL and PCL also help in keeping the articulating surfaces in contact during flexion and extension. The first of Kapandji's model helps to demonstrate the role of the cruciate and collateral ligaments of the knee. Specifically, it helps to demonstrate how the cruciate and collateral ligaments are selectively stretched during movement, and how the femoral condyle is pulled back on the tibial articular surfaces during movements of flexion and extension. In the video, you can see the femoral and tibial cutouts attached by 3 colored rubber bands. The pink rubber band represents the PCL, the orange rubber band represents the ACL, and the green rubber band represents the LCL-MCL. During the movement, you can see that the PCL and ACL helps to keep the articulating surfaces close together. You can also see how the PCL undergoes stretching, while the ACL undergoes a more compressive action. The LCL-MCL ligament can also be seen stretching and unstretching as the movement continues. The second of Kapandji's model helps to demonstrate how the cruciate ligaments, so in this case the ACL and PCL, help to deter anterior and posterior sliding, while still allowing the knee to undergo flexion and extension. This model was conducted using 2 hard cardstock pieces acting as the articulating surfaces connected by 3 slips of paper that work to mimic the cruciate ligaments. In the video, you can see that the rectangular surfaces are unable to slide completely past each other and are restricted by these slips of paper acting as the ligaments. This model is capable of acting as a hinge joint and can be seen in the video when I lift it open. So in all, Kapandji's second model is an easily seen depiction of this stability principle, restricting anterior and posterior displacement. Kapandji's third model helps in determining the contours of the trochlea and condyles. By tracing the tibial plateau as it moves from left to right as though it were in flexion and extension, the tracing would show the curvature of the condyle. However, while tracing the movement of the patella during these movements, it would give you the contour of the trochlea. Theoretically, by changing any of the ligament lengths and attachment sites, you could change the contours traced in this model. This makes the third model relevant in understanding how these contours form the way they did and how they may vary person to person depending on their geometry. So in conclusion, after creating 3 of Kapandji's knee models, I can confidently say that his models give an easy to understand visual aid for those trying to understand how the anatomy of the knee results in the specific mechanics we discussed. I can also confidently say that creating these models with young children, like middle schoolers, would be an excellent method to get young children interested in human body mechanics. If you have any questions, please feel free to reach out to me at any time via email, and I will be sure to get back to you as soon as possible.